As per the National Osteoporosis Foundation, 70% of people over 65 with osteoporosis have never been screened and don't know they have osteoporosis. When the skeleton loses mineral density, the structure becomes thin and unable to take normal weight, leaving bones that break easily. To find out if you have osteoporosis, you will be given a bone mineral density test, also known as a DEXA scan. This simple and painless test takes about 15 minutes. This is a covered benefit for women age 65 and up, and men age 70 and up, and anyone younger with a risk factor. Calcium, vitamin D, physical activity, and daily exercise can prevent bone loss. The load that you put on your bones varies by the kind of activity you do. We think about load as multiples of body weight. The more body weight or load involved in an activity, the more effect on bone density. When you swim or cycle, you are not adding any body weight or gravity to your bones. If all you do is swim, you could actually lose bone density. Walking or brisk walking loads 1 to 2 times body weight and can help prevent bone loss. If you run or jog, the greater impact with the ground loads 3 times your body weight. To build bone density, you need loads of at least 4 times body weight. You can get this by jumping or strength training. Balance is critically important. If you have good balance, you are less likely to fall. Try this. Hold on to the back of the chair in front of you and see if you can lift your right leg and hold it for 5 seconds. Now let go of the chair. Can you balance without holding on to the chair? If you work on this small exercise when you are brushing your teeth, you will notice a difference in a short time. Begin by holding onto the counter and standing on one leg. Try the following suggestions to prevent falls. Stop multitasking. Pay attention to where you are walking and what you are doing. Remove trip hazards. Remove throw rugs and keep an eye out for pets. Get your eyes checked. Your vision plays an important role in preventing falls. Keep a nightlight on. Most falls happen at night in the bathroom. Shed some light on your steps with a nightlight. Get your medications checked. Taking numerous medications puts you at higher risk for falls. Talk to your provider to make sure your medications are not negatively interacting with each other. If you are at high risk for fracture, you may benefit from treatment. Determine your risk. Discuss your options. Decide what's best. There are several treatment options available. Bisphosphonates are medications that slow bone loss. They include Fosamax, Actonel, and Boniva, and intravenous medications like Reclast, which we administer in our office. Rank ligand inhibitors like Prolia help prevent bone loss. Prolia is a subcutaneous injection given twice a year, and it may be a better option for those with high risk of fracture. It's a safer option for those with chronic kidney disease and is covered by most insurances, including Medicare. Anabolic agents are medications which stimulate bone growth. Forteo and Tymlos are examples of these daily injections given over a period of 2 to 3 years that patients can administer at home. Anti-sclerostin antibodies, like Evenity, is a newer treatment that helps build new bone or slows down bone loss. This subcutaneous injection is administered once a month at our office. Your Advocare Arthritis, Osteoporosis, and Rheumatology Associates team will discuss appropriate options with you to determine the best course of action.